For 50 years, emergency nurses have been saving lives. We treat patients with all types of diseases, traumas, and social situations. But one thing has remained constant.
Emergency nurses are the experts when it comes to the one thing that gets everyone's blood rushing and adrenaline pumping. Code Blue!
50 years ago, nurses looked to doctors for orders, but it was one nurse's contribution that changed emergency medicine forever with her groundbreaking and life-saving intervention. Anita Dorr realized it took far too long to gather the necessary medical equipment during an emergency. With the help of her fellow nurses, she made a list of all the items needed and built a prototype of the crash cart in her home. Today, crash carts are used around the world.
Anita was also busy organizing meetings for emergency nurses on the East Coast. But little did she know there was another nurse by the name of Judith Keller doing the same thing out west. They soon learned of each other and joined forces. That's when the Emergency Nurses Association was born.
Not only did the role of a nurse look different in the 1970s, but the uniform did too. Nurses were almost exclusively women and were required to wear a white uniform with stockings, a dress, closed-toed leather shoes, and the iconic nurse's cap. It didn't take long to learn that hydrogen peroxide would take blood out of any clothing.
It wasn't just the clothing that the blood ended up on. Nurses were often splattered with blood in time with the rhythmic beats of a patient's pulse, especially during the care of a trauma patient. Coming into contact with large volumes of blood was expected, and there wasn't an awareness of the potential risk.
Unfortunately, in 1972, Anita Dorr, co-founder and first executive director, passed away.
Nurses started to see hepatitis B and HIV in the 1980s and gained a better understanding of contagious diseases. They started to wear gloves for just about any contact with patients.
In the 1980s, the role of women in society started to change. They became less subservient and asserted more independence. Traditional nursing caps fell out of use, and scrubs became the favored, more practical attire.
Electronic health records emerged within health systems operated by the federal government and some university hospitals. Many nurses have never touched a computer and had to put in hours of practice to learn electronic charting after years of using pen and paper.
With little downtime for a breather or even a bite to eat, break rooms weren't provided for yet another 10 years, so an ashtray was kept in the med room so nurses could catch a quick smoke while they counted narcotics. By 1985, the ashtrays were removed from the emergency department.
In the 1980s, there were no infusion pumps or auto syringes, and the emergency nurse had to calculate IV drip rates by counting drops in the drip chamber. They used pieces of tape adhered vertically on the bag with hour marks to see if they were running at the correct rate.
This decade saw the introduction of the emergency nurse practitioner specialty. These advanced practice nurses could now diagnose and treat patients who presented with emergency and acute symptoms. They also performed procedures.
In the 1990s, the emergency department started to see an increase in male nurses.
A strong focus was also placed on injury prevention in the 1990s as the importance of emergency nurses in the community became more prevalent. The Emergency Nurses Association established a formal relationship with EN Care. Programs were taught in high schools on the consequences of drinking and driving and underage drinking.
The 2000s continued to see a trend of increased male nurses, so much so that Benny Merritt was the first man to serve as ENA president. During his presidency, Benny challenged the sacred cows and focused on advancing the profession and the association. With that, he dubbed 2000 as the Year of the Member and built a 300-person membership committee to enhance member benefits. One of the long-lasting efforts was the creation of ENA Connection, the association's all-member magazine.
In the 2000s, community education increased for bystander CPR. Kits were developed to educate the public on the core skills of CPR in just 20 minutes. And in 2005, AHA published guidelines that recommended a new compression to ventilation ratio of 30:2. In 2008, new recommendations were released that said bystanders could skip mouth to mouth and use hands-only CPR.
Sadly, this was the decade that co-founder and the first ENA president, Judith Keller, passed away at the age of 89. To honor her and Anita, the ENA Foundation created the Judith C. Keller Memorial Scholarship Endowment Fund and the Anita Dorr Memorial Endowment Fund to provide additional education funding for emergency nurses. Additionally, ENA began honoring the best of the best with the Judith C. Keller Award, which is presented each year to one member during the Anita Dorr Luncheon held as part of the association's annual conference.
The 2010s offered the association many accomplishments and opportunities to show an emergency nurse's commitment to care. In 2010, ENA members sprang into action following the earthquake in Haiti to help support those impacted in one of the worst humanitarian disasters that resulted in 250,000 injured. In 2011, ENA released its Workplace Violence Toolkit to help ED leaders mitigate violence in the workplace. Also that year, ENA created the ENA Lantern Award to recognize emergency departments for their exemplary work as it relates to leadership, practice, education, advocacy, and research.
Today, emergency nursing looks completely different from previous decades. The ED is filled with nurses of diverse backgrounds and experience, and ED nurses now serve in very different roles than their predecessors from decades earlier. Forget about lab coats, scrubs are commonplace in the fast-paced world of emergency care. This year, amid the COVID-19 pandemic, new accessories have become the standard for ED nurses as they don full PPE for entire shifts to care for patients during this ongoing public health crisis.
COVID-19 has shown the world the vitally important role an emergency nurse plays in healthcare. We are the front line when things go bad and patients start rolling into the ED. 5 decades ago, we did as we were told. But today, emergency nurses lead codes. We do so in a controlled environment. The code is an art form, practiced and perfected by an ED team anchored by emergency nurses committed to caring for patients in a way that has increased survival rates and saved lives.
Hi, my name is Micah David, and I represent the future of emergency nursing. I'm ENA's 2020 Emerging Professional Liaison and provide insight to the Board of Directors on behalf of the emergency nursing graduate. 50 years ago, the emerging professional would be an afterthought, but today, I'm the charge nurse. And I'll be running this code.